Good morning. Dr. Robert Waters here, and this morning I'd like to talk about intravenous treatments. Often patients have absorption problems and they come here with extremely low levels of minerals and fatty acids and even some vitamins, and they're unable to digest their food and absorb the good of their food, and that is partly the basis of their illness. A second group of people have autoimmune phenomena that may be caused by an infectious process and have been unable or unwilling to tolerate antibiotic therapy and wish for alternative treatments to eradicate infections. In these cases, we use a variety of intravenous solutions to treat. And one would be, of course, vitamin C. It is now well established for the last 50 years that vitamin C at large doses given intravenously eradicates a variety of infections. I have treated 4 or 5 cases of acute mononucleosis, very severe illness documented by blood tests. They had just been to a doctor and got the diagnosis, and in 3 days' time, 2 IV vitamin C treatments have brought them back to health. It's rather remarkable. We use this also for acute upper respiratory infections, tonsillitis. I've treated one of my daughters with one of the worst cases of tonsillitis I ever saw without antibiotics, using vitamin C IV and using a second intravenous treatment, and that is ultraviolet blood irradiation. Now, this treatment goes back to 1922. It was developed here in the United States by a Dr. Knott, and we will have a separate segment on the use of ultraviolet blood irradiation. The next area that I'd like to talk about is the use of detoxification treatments. And of those we have 2. We of course have chelation therapy that we did another segment on, and then we have the use of the molecule called glutathione. Glutathione is a tripeptide. It's 3 amino acids strung together, and it is made by the human body normally. And it has 3 functions. It removes toxic metals from the body. It binds and removes toxins like xenobiotics, various types of plasticizers, false estrogen metabolites. Virtually all of the chemicals are conjugated with glutathione and removed from the body. And the third thing it does is very important. It recycles all of our oxidized vitamins. You see, when a vitamin neutralizes a free radical to protect us, it itself becomes oxidized. And it must be turned back into an active vitamin compound. And ultimately, glutathione is the molecule that does this. Now, we're able to infuse large doses of glutathione into the veins and affect detoxification by that method. So we have ways to eradicate infections without antibiotics, to detoxify the body intravenously, and finally to replace vitamins and minerals that aren't being absorbed because of digestive issues.